Hey everyone, I want to talk a bit about Gui Zhi Tang. So with Gui Zhi Tang, you don't actually use it in clinic that much, but it's the basis of a lot of formulas. So the most important thing to know about Gui Zhi Tang probably is the 1-to-1 ratio of Gui Zhi and Bai Shao. So you've got 9 Gui Zhi, 9 Bai Shao. And that's really important because the Gui Zhi is warming the blood and warming the Tai Yang. So if Gui Zhi is in your formula, it's warming Tai Yang. So it's probably a Tai Yang formula. Therefore, you'll have aversion to cold, joint pain, perhaps easy sweating in this case of the Gui Zhi Tang. Because remember, either you've got a loose pulse, floating loose pulse Zhongfeng, or you've got Shanghan cold strike as opposed to wind strike, and you've got a Ma Huang formula. So with a Gui Zhi Tang patient, generally there's some easy sweating. It's a bit more deficient than a Ma Huang Tang patient. So there's some blood deficiency, there's some fluid deficiency, there's a bit of yang deficiency. So they're cold, they sweat easy, they feel deficient because the pulse on the right reflects blood and a lot of substance. So generally overall, probably the right pulse will be a bit weaker. And again, in your left pulse, there won't be any Xiao Yang kind of wiriness or sore throat or alternating chills and fever going on. You just got a straight Tai Yang, floating loose pulse, bit deficient, bit blood and Yang deficient of the patient. So yes, it is for day one of a cold where the patient is sweating easily and has an aversion to cold and some joint pain, but you don't catch it that much. But to know that you could use it for that, or you could just use it for a very safe formula for someone that's just generally blood and Yang deficient, feels the cold. And also to know that it is the basis of many, many formulas.